Hello, everyone. A very good afternoon to all of you. I'm Sayukta from Men's Good Health Team, and I'm sure all of you must be doing good. Today, we are going to discuss a very important topic BPH. Now, urological health is essential for both men and women, but there are many myths and misconceptions that can lead to confusion or unnecessary anxiety. Understanding the truth behind these myths can help you make better decisions about your health. So, today, to throw more light on the subject of BPH and guide us on the myths of urology, we have with us renowned urologist Dr. M. Gopalan. Urologist, he is M.S DNB in urology. He is currently practicing at Priyan Hospital, Madurai. A very warm welcome to you, Dr. M. Gopalan.
Yeah, good afternoon. Yeah.
BPH, doctor, this is the topic of today's live, and as we know, it is related with the benign enlargement of prostate. Now, prostate is a gland which is present in males, in men. So, first of all, doctor, we would like you to share some knowledge about prostate. What is its, function? Where is it located, etc.
Yeah. A prostate is a male sexual accessory organ. It secretes nutrition for the sperms, white fluid which comes with semen, no? That is secreted by prostate. So it will give nutrition to the sperm to swim and catch the ovum. So prostate is very important organ in male reproductive system. It is normally around 20 grams in size, around 20 to 25 grams in size. Once hormonally, men is very inactive after the age of 50, it will enlarge due to hormonal changes because dihydrotestosterone, which is the potent male hormone, testosterone is converted into dihydrotestosterone. Once age increases, this dihydrotestosterone will be reduced. So changes in the prostate will occur. So prostate is very important gland for male reproduction.
Right. Now, doctor, where is it located or positioned in our body? I mean, in a
Yeah.
man's body? Because we would like to understand that how the urinary, system is there associated with BPH.
Yeah. Prostate is just below the bladder, the storage capacity, the storage organ of the urine, no? Bladder. Just below the bladder, the prostate is situated. So it is this prostate is surrounded or it is in the middle of the urethra, it is covered. So only when the prostate enlarges, it compresses or obstructs the urinary flow. So prostate is completely around the urethra. So once enlarged, it will come and obstruct the pathway. Then only urinary symptoms will occur. So it's below the bladder and surrounding the urethra, the male tube, urine conducting tube.
Right, right. And doctor, as the topic of today's discussion is BPH. Now, what is BPH and how it happens?
Yeah, already I told it's accessory gland. Once after the age of 50, dihydrotestosterone, that is active testosterone, is reduced. So what will happen is the prostate will enlarge, cell will enlarge. So it will obstruct the urinary tube, the urethra, near the bladder neck and prostatic urethra. So what will have so many urinary symptoms. So after the age of 50, this BPH, benign prostatic hyperplasia or hypertrophy, is a non-cancerous, that is benign, non-tumorous condition. It will be easily tackled.
Can we look at it as a sign of aging, doctor? Is it that normal, like graying of our hair or getting wrinkles on our skin?
Yeah, definitely. Around 60% at the age of 60 years, around 80% at the age of 90 years, almost 100% the age of more than 80. Definitely have enlargement of the prostate because of the hormonal changes, metabolic syndromes, hypercholesterolemia. Metabolic syndrome means hypertension, diabetes mellitus, so hormonal inactive. So many reasons will have. So definitely it's a very common condition. It affects the urinary flow and quality of life after the age of 50.
Right. As you are continuously saying and emphasizing on the fact that it obstructs the flow of the urine. So we can understand that, that can be one of the biggest signs or symptoms. Now, would you like to shed some more light over the signs and symptoms of BPH, doctor?
Definitely. Definitely. They have two types of symptoms, storage
Okay.
as well as voiding. Voiding means you will see most of the old age people around 70, 75, they will go to the toilet frequently. They will wait for urine to complete so many minutes, they will wait. So these are all because of the prostatic enlargement. They will complete the urination after so many minutes, after 5 minutes or 10 minutes, like that. Something they will struggle to finish it up. So I have told initially voiding and storage. Voiding means they have very weak flow. That is, speed of the urination is very, very poor. They will void in minutes, so many minutes they will take. They will not void in single stroke. They will void intermittently. They have post mixation dribbling will be there. Storage symptoms also will be there. Storage means frequency. They will go to the toilet every 10 minutes, 15 minutes, half an hour. Night, they will wake up around 2 to 3 times to urinate. These are all the symptoms of prostatic enlargement. Then have urgency. They will rush to the toilet. Sometimes they will leak. These are all the symptoms. Sometimes they will have pain during micturition because of the obstruction. Sometimes, very rarely, they will have blood in the urine. Very rarely, they will not pass urine. These are all the symptoms of prostatic enlargement.
Okay, doctor, fair enough. So, doctor, as you said, these symptoms, they are so common, and you rightly said many a times we see these symptoms after certain age in the male members of our family. But when we approach them and ask them, let's go and consult a doctor, let's go and consult a urologist, they'll often say that, see, I'm aging. So I'm bound to have these issues, urinary issues, or I'm diabetic, or I have hypertension, or I have other, comorbidities, and they all have these, symptoms. So don't worry, I'll have to live with it. I'm living with it. So they make it, they're so it's into their routine now. They are so used to it, and of course it do hampers the quality of their life. They stop socializing, they stop going to public places, etc. But how you counsel your patients when they say that it I'm supposed to live with it?
Not, they should not live like that. Definitely, they have very good symptom relief. They can feel very young. They will pass urine like young chap, 18, 20 years old, with the speed also. So they have to consult a urologist very early. So we can prevent the progress of the prostatic enlargement. BPH progress will be stopped. The symptoms also relieved by very good alpha blockers and 5-alpha reductase inhibitors. The one surgery which is reduced more than 60-70% world all over is prostatic surgeries because of the very good alpha blockers and 5-alpha reductase, very less side effects. The symptoms will be relieved very, very early. The progression of the disease also stopped. So after 70 or 65, they should not tell this is because of the age. Because if you give very good drug, definitely they relieved, their age will be reduced 20-25 years backside.
Wow. So this is a good news in case you have BPH or in case you have these signs and symptoms. Don't start living with it, assuming that it is a sign of aging and you will have to live with it. We have very good treatments available these days, and in the field of urology, we are seeing so many advancements taking place. So please go and consult a good urologist. You'll definitely get relief. Now, Dr. We have already spoke about these symptoms and signs. Many a times what we see, there is no signs or symptoms, no problem with urination, no frequency, urgency, etc. But when they go for their, maybe routine checkup, annual medical checkup, etc., they get the ultrasound done, and that's when they go and consult a doctor that, see, my prostate is enlarged and I'm not having any symptoms. So now I would like to talk about the asymptomatic side of BPH. How do you deal with it?
One thing, if the patient is not symptomatic, means any size of the prostate cannot be, no need for any treatment also. So if the patient has no symptoms, prostatic size is very big by ultrasound detection, incidental finding, residual urine is very less, patient voiding and storage symptoms, no symptoms at all, no need for treatment. Another thing, if the patient has severe symptoms, very small prostate size wise, he should be treated. So one thing you should very clear, if the patient is symptomatic, he should be treated. Otherwise, all the parameters are within normal limits, no urinary problems, residual urine is less, good stream, PSA normal, everything, no need for treatment.
Right. So, in case you have symptoms, please do not ignore them. Go and consult a urologist. No symptoms, then you, of course, don't need any sort of treatment. But then be careful in case there's anything which is not normal. Please go and consult a doctor. That's really important. Now, doctor, because we have spoken about the that how it is in these days that we can treat BPH and the patient can get relief from all the signs and symptoms. Now, what happens or what are the potential complications if a person keeps ignoring these symptoms, they start living with it and don't get it treated? Any potential complication?
Definitely. They will not be able to pass the urine. One sudden day, they will end up in retention of the urine. They will not pass urine. Bladder is distended, pain will be there. If long-standing obstruction, what they will have is increase of the storage of the urine in the bladder results in back pressure effect. It will affect the kidneys. Suddenly sometimes they will come and show your urea creatinine is high because of the prostate and a very big high residual urine in the bladder. Back pressure effect, both side kidneys will be hydronephrotic. Then they will have blood urine and serum creatinine will be very high. Another thing, if they are not treated properly, they will have bladder stones because of the high residual urine in the bladder. Sometimes they will land up in blood in the urine. Sometimes they will go for sepsis, infection because of the urine storage. Kidney will be getting infected, pyelonephritis. So many things will happen. So definitely, any symptoms, you should be treated.
Right. So please don't ignore again because it can go on and in fact damage your kidneys. So please be
Definitely.
very careful in case you have these symptoms. Go and consult a good urologist. That's very important. Now, doctor, though we are talking about BPH, which is the benign enlargement of the prostate, but because benign is there, I'm sure the cancerous part is also there. Though it's not our topic today, but for just common information, I would like to ask: in case of prostate cancer, are the symptoms similar?
Definitely. Cancer is different entity, but the same symptoms will have for a cancer prostate also. Frequency, urgency, thin stream, incomplete emptying, dribbling, intermittency, hesitancy, everything will be the same symptoms. So you should be different entities, but the same symptoms will be same only. So you
Right. So
should
it
be
becomes
evaluated thoroughly.
right. So it becomes even more important not to ignore the symptoms because, God forbid, but it can also be cancerous. Though in it is said, I have read somewhere, Dr. Gopalan, you can correct me, that prostate cancer is the easiest cancer. It is one cancer which grows really, not that fast like other cancers, and it can be very easily treated if detected early. Is that correct?
Correct. Yeah. If you detect very early, complete cure will be there. Their survival is very high compared to the other cancers.
Right. So that's the silver lining. But the important part is that in case you have symptoms, uh, most of the time it's going to be BPH only. But just in case, it is cancer, you will get to know about it early. And of course, the treatment will be there. Doctor, how do you treat a patient with prostate cancer? I mean, here we would like to discuss a bit about prostate cancer so people understand that even the treatment and everything is there for
Yeah.
prostate cancer.
Yeah. If you detected, if a urologist or your team detected prostate cancer, it's organ confined. Your treatment and your survival is very good. Completely, we can remove robotically, laparoscopically, radical prostatectomy. Complete cure. if the disease is beyond prostate, nodes, and bladder neck, bladder base, lymphatics, hematogenous, your treatment differs. So, for every cancer like that, so chemotherapy or hormone therapy or radiotherapy like that. But it confined to the prostate only means complete curation by surgery is the best treatment. If it is metastasis or it's spread in lymphatics and bone or liver or lung or brain like that, it mainly go for hormone as well as chemotherapy only. So it's a different entity, but when it's confined to the gland, curative is more than 90%, very good survival.
Okay. Now, doctor, we would like to talk about the way of diagnosis, or what are the tests that you normally recommend to patient who comes to you with these symptoms. As a doctor, till that time, also don't know whether it's BPH or it's prostate cancer, because the symptoms are similar. So, what are the tests that you normally suggest?
Yeah, coming to the BPH first, you will do urine culture and routine test. It will show any urinary infections are there or not. Then you have to do blood test, urea creatinine. Because of the prostatic enlargement, how your kidney functioning. Then serum PSA. This is a very important test. It is if less than 4, it's most probably BPH only. With more than 10, very high chance of cancer prostate. So 4 to 10 is a gray zone. So these tests must be done. Then in the BPH patient, after the blood test, you have to do ultrasound examination for the size of the prostate, to see the kidneys and post-void residual urine. After that, you have to do, you have to do, flow means you have to measure the flow of urine, how much speed you pass, when it starts, how you finish everything, Euroflow test. This itself enough for a BPH. If you suspect malignancy or cancer prostate, you have to do MRI of the prostate to see any suspicious prostatic malignancy is there or not. Otherwise, same symptom wise, same only. These tests should be done.
Right. We have seen in many developed countries, PSA is mandatory after a certain age. Now, what is this PSA, doctor, and how it detects or determines the risk of prostate cancer?
Yeah, in this cancer process very common Afro Americans in US. So in their health insurance scheme, they started even 45 itself. They are repeating PSA every 6 months. But in our part of country and in Asia, prostatic cancer is increasing, but not like Afro Americans, like US. So after the age of 50 or 55 only, we are doing PSA. If the patient has history of father or brother having CA prostate, definitely they should do every year serum PSA. PSA means prostate specific antigen. This is a enzyme secreted in the prostate. If it's a benign, it will not come out of the prostate. It is less than 4 nanogram per ml in the bloodstream. Once it's breached the basal layer, breach the prostate in malignancy, it will be very high, around 100,000 also it's possible in metastasis. So if prostatic specific antigen is increased means maybe sometimes very rarely any infection also PSA will be increased, but not like malignancy. So more than 10 means you should be evaluated to rule out the malignancy. Less than 4, most probably benign only or infection only. Gray zone is there. You should be consulted with your urologist and other tests also.
Right. And what are the treatment options available for BPH, doctor?
Yeah. What I initially told, if the prostate size is very big, no symptom means no need for treatment. Even
Right.
small prostate, very big symptoms, very high symptom scores, definitely you should be treated. First of all,
Right.
best drugs available for the prostate enlargement. So, if the patient's prostate is less than 25 grams, patient has mild symptoms, just alpha blocker is enough. According to the age, we can give silodosin, tamsulosin, alfuzosin. It will give good relief. If the prostate is more than 25 grams, you have to add dutasteride to prevent the progress of the disease. It's a 5-alpha reductase inhibitor. It will reduce the size of the prostate 50% in 6 months. So you have to give a alpha blocker in small prostate, see 6 months. Definitely they have relief. If more than 25 grams means you add 5-alpha reductase 6 months and re-evaluate after 6 months. If any complication arise or medical management fails, then only you go for surgery. Otherwise, no need for surgery at all in BPH management.
Okay, doctor. And doctor, do family history plays a role or increases the risk of BPH?
Definitely, it's hormone related. If the father and the elder brother has prostate symptoms in early, this patient also will get early. So its genetic predisposition is there.
Okay. And how important is having a good lifestyle, or do as a doctor, as a treatment option, you also suggest for lifestyle modifications?
Definitely, all metabolic syndromes should be treated and you should be in control. Diabetes should be in control. Your hypertension should be in control. Your hypertriglyceridemia or hypercholesterolemia should be controlled. You should be actively exercise. Avoid caffeine frequently. Avoid constipation. Good exercise. Good sleep. Stress free. Everything come to play a role to prevent the progression of the BPH as well as good quality of life.
Whatever treatment options you have told, doctor, I'm sure it takes a long time to, get it under control. Or are they like diabetes or hypertension medicines that goes on till a long, long duration of time? Is the medication so for BPH?
Definitely. BPH also not like that. You cannot
Uh-huh.
continue lifelong. Sometimes you can take up to 5 years, 10 years like that. If the patient's prostate is very high symptom score, they should be around 2 to 3 years, 5 years to shrink the prostate and good urinary relief. So they have to continue some more years. So it's not lifelong. Some patient very big prostate, they are with the complication also, they are not willing for surgery. They have to take the medication for long to relieve the symptoms.
Okay, doctor. Doctor, you said initially that people get up during night from their sleep and go to urinate, which is one of the major symptoms of BPH. Now, again, people find it a routine. They have made it a behavior. It's in their lifestyle that they get up from their sleep and they'll go urinate, come back, have water, sleep. Now, many a times they'll say that this is normal. Getting up 2, 3 times in the night is normal. Now, what is normal as per medical science? Getting up once or twice, is it okay, or we need to be careful if a person is getting up 2 to 3 times to urinate in the night?
Yeah, it is medically only one time is allowed to wake up in 8 hours sleep. That is normal. If you are waking up more than once, something is abnormal. Whether you are more hydrated or caffeinated drink in the night or more diuresis happen, it's possible. But 2 to 3 times in a day, 2 to 3 times in a night, definitely abnormal. They will have very poor quality of sleep. Their day work will be spoiled. They will sometimes in the sleeping duration time they will fail and fracture will be happen. So one time is allowed. Even any food you take more than one, you should be evaluated.
Right. So it's a very important takeaway in case you get up twice or thrice during the night from your sleep, you get up and go to pee. It's not normal. Please go and consult a urologist. And more importantly, because it, of course, as Dr. Gopalan is saying, it hampers your lifestyle. Of course, it's disturbing your sleep. It's making you drowsy, and the chances of falling in the bathroom, etc., are so common with elderly people. So please be very careful about it. as especially those who have seen their parents or elderly people at their home getting up more than once. Please be careful in case you see your family members getting up more than once. Do consult them and do take them to a good urologist. Now, again, doctor, we have this habit of drinking good big glass of water or milk before we go to sleep. Our male people back home also do that. Again, in case they get up from their sleep to urinate, before going back to sleep, they'll have one more glass of water. And if they get up twice or thrice, they'll have one full glass of water. I'm sure your patients also tell you that this is our routine. Is it a okay thing, or we need to modify our water intake as well?
The urine production is so many factors influencing it. One is diet, one is temperature around your sleeping room, and your body habitus, and your comorbid conditions, diabetes or diabetes insipidus, or urinary infection. So many things play a role. Even if you drink 2 liters of water, if bladder is to get full, it will take 3 to 4 hours. So, if you're in a cool climate and AC, so you are hydrated, diuretic food you take means it will fill yearly. So, sensation will come. So, if suppose they have prostatic problem, already urine will be stored in bladder because they will not empty completely. So, what will happen is immediately from kidney, urine will come to the bladder. They empty, storage will be there next time also. They will repeatedly, frequently go. Now, more than 2 times, 3 times, 5 times like that. So, even if you have 6, 7 hours sleep, with one time only wake up, it's good, normal only. Normal, good, healthy people will have like that. Otherwise, what I told, diabetes, climate, and your infection level, bladder contraction, food, what do you take, so many things. There 1 or 2 times they will pass. It's okay. We'll be able to control. But the patient not able to control, rushing to the toilet, leaking before entering into the toilet, incontinence, they should be evaluated. And prostatic enlargement people also should be evaluated for the residual urine.
Right. Now, doctor, we are getting so many questions from our viewers. I'll take them
Yeah.
one by one. Yash Sharma is asking, does alcohol consumption worsen BPH symptoms?
No, it will produce diuresis. They will go to the toilet frequently, but it will not aggravate the prostatic symptoms. But sometimes diuresis will happen. They will go to frequently to the toilet up to the effect of the alcohol. After that, they will be okay.
Okay. Abhishek Mishra is asking, can weight loss help with BPH?
Definitely, one of the very good relief you have is weight loss only.
Okay. So obesity is a risk factor,
One of the
doctor?
main, yeah, metabolic syndrome, obesity comes in that. Definitely one of the main cause of prostatic enlargement. Weight loss is very good. They will help in emptying the bladder properly.
Okay. Right. Rohit John is asking, is coffee or tea bad for BPH?
Coughing is stimulation. It stimulates the bladder contraction. So if they already have frequency, they will. If you take more than 3 cups, 4 cups of coffee, they will frequently go to the toilet. Symptoms will worse. Tea, it will not have any effect over the contraction of the detrus or contraction of the bladder.
Right. Chandramani is asking, can BPH turn into cancer over time?
No, that is a different entity. BPH always BPH. Cancer process different entity.
Okay. Now, doctor, how common is prostate cancer? I mean, BPH is quite common. We see a lot of male having BPH. The age may vary. I mean, as you said, after 80 or after 90 years old patient, they get BPH, which is very common. Now, how common is prostate cancer in men?
Yeah, it's not common in Asia or our part of country, in our country also. It's very common in US. The Afro-American genes has very high potential to change the cancer in prostate. So, but now also, because of so many changes, environmental changes, stress factors, and our lifestyle changes, metabolic syndromes, so many things coming to play. In India also, see cancer process increasing, but not like US.
Okay. Chandran Iyer is here. His question is, can sitting too long affect prostate health?
uh, it will have no impact on prostate health. One thing is, if we around 45, 50, you should ejaculate weekly twice. It will give good health. You should ejaculate frequently, then avoid the enlargement sometimes. We can postpone. Sitting is no way related to the prostatic health.
Now, because Chandan is asking about prostate health, I also want to know, Dr. Gopalan, that how a man can keep his prostate healthy. Anything to they
Yeah,
can do?
I am already told. You should be physically very active.
Hmm.
Metabolic syndrome should be controlled. Avoid constipation. Take adequate amount of hydration or water. Frequently ejaculate. After the 45, weekly twice we ejaculate. If semen stored also, it will increase the risk of prostatitis as well as prostatic enlargement. So you have to ejaculate every 3 days to 4 days once. These are all the symptoms will help. If you have metabolic syndrome, it should be controlled. Exercise very important. Obesity, you should weight loss already told. Obesity should not be there. So you have to reduce your weight.
Does BPH doctor also affect the sexual life of that patient?
Definitely, definitely, very much. If any prostatic enlargement, they have very high chance of erection dysfunction. Then they have,
Okay.
if you start alpha blocker, by the drugs itself have some ejaculatory disturbance will be there. So BPH definitely decrease your sexual life, or they have definitely erection dysfunction.
Okay. And once the treatment is done, once the BPH is taken care of medically, then I mean, the sexual life comes back to normal? Chances are
Definitely,
there?
if you prevent the progress of the benign prostatic enlargement or hyperplasia, definitely your sexual life is very good. Your hormone levels will change because of your exercise, weight loss, and so many things. So definitely they have good sexual life.
Pritha Nanmer is here. Her question is, can BPH come back after treatment?
No, once it's depend upon the how big your prostate is, how genetically you are prone to enlargement of the prostate, how long you have to continue the drug. If you are in mild symptomatic, moderate symptomatic, your medical management good means you have to continue. Stop in some years, you re-evaluate. If recur means restart your medication because it's hormone related. Some more time, if that will progress. After some time, you have static period. You will be managed without drug also.
Right. Now, Kalpana Jaiswal's question is, though before this we talked about how BPH can affect the sexual activity or sexual life of that patient. Kalpana is asking, can sexual activity affect BPH the other way around?
I have repeat it.
Can sexual activity affect BPH? Is this even a relevant question, doctor?
Yeah. If you are more sexually active, your progression will be stopped or reduced. If you are not active, your progress will be in a high speed. Definitely, you have so many problems.
Okay, right. So this whole session was about BPH, and with BPH, we have also spoken a bit about prostate cancer, and of course, what are the symptoms, how it can be diagnosed, and how it can be treated. Now, before we sum up the whole session, doctor, any do's or don'ts, or anything that you would like to tell our viewers as a take home message about BPH or about prostate health?
Yeah. First of all, exercise regularly, keep fit, eat healthy diet, frequently ejaculate, avoid constipation. Your metabolic syndrome should be controlled. Diabetes, hypertension, hypercholesterolemia, so many things should be controlled. Stress free, sleep well. This is my advice.
Right. We all are living a very stressful life these days. It's very hectic for all of us. But then it's important to take good care of our health, be it men or women. The first step is to have a good lifestyle, healthy lifestyle, eat healthy, sleep healthy, drink properly, and drink the right thing, of course. And of course, have a stress-free life. That's very important. So invest in your hobbies, invest in what excites you, and that investment is not the money investment, it's your time investment. So if you feel good or relaxed and happy with something, engage yourself in that activity. And again, the most important part, in case you have symptoms, please go and consult a qualified doctor. For example, today, as we spoke about BPH, which is the benign enlargement of prostate in men, in case you have those frequency, urgency related symptoms, do not ignore it, or do not make it a part of your lifestyle. Go and consult the correct person, which is a qualified urologist. Don't fall for quackery. Don't fall for what the influencers on various social media platforms who are not qualified urologists are telling you to do. Don't go for those DIYs. Go to the correct person, which is a qualified urologist. They'll help you. They'll do the diagnosis. They'll suggest you the best treatment. Go to a urologist, trust your doctor, follow the prescription, follow the doctor's advice. That's very important. Thank you so very much, Dr. M. Gopalan. It was wonderful talking to you. First of all, thank you for taking out your valuable time for this session and also for making it so informative. Thank you very much once again.
Thank you very much. Thank you.
Thank you, doctor and viewers. Thank you for your active participation in today's session. Stay happy, stay healthy. And in case you have any problem, of course, go to the expert doctor of that problem. Today, we had our session on BPH, benign enlargement of prostate in men. So, thank you once again. And Men's Good Health is our YouTube page. So please stay connected on that for more information and updates. We are also available on Facebook, Twitter, and Instagram. Thank you and have a great day ahead. Goodbye.